Okay, part 3. God, this is so stupid. I wish I could just do one video. I'm sorry, guys. But now we're talking about the medical problems that can occur from circumcision, not only immediately, but also long term. So any medical procedure has a risk involved, and usually you sign a contract saying that if it does happen, you're not going to sue the hospital or the doctors, and you're just accepting that it's part of the risk. Obviously, a newborn cannot make this decision because it is a newborn. However, you can give your baby vaccines, and if there is a medical problem at birth, you fix it. And a newborn doesn't have complete legal rights to decide whether they want it or not. However, circumcision is not a medical necessity, as I've stated in the last video. If a child is born without a limb or has some weird issue where there's immediate surgery or something to fix it, and something goes wrong, at least the child knows that there was a reason. Like that they understand that the parents were trying to do the best thing possible, or the doctors were, like there was no other choice. But with circumcision, the child won't have that. So if there is a medical issue, if it's botched, there will be resentment towards the parents, the doctors, and problems like bleeding and infection occur not only from rabbis sucking the tip, they happen 1 in 100 times. So 1 out of every 100 circumcision, there is a medical issue. So I've been throwing around statistics a lot during this whole thing, so this is a big comparison for you guys. So you can understand that it's pretty common. It's way more common than any of the medical issues that a lack of force can cause. Obviously, a large contingent of these issues are rather small, like excessive bleeding, but there are complications that can be way worse, like really, really bad bleeding, infection, and problems with foreskin adherence, urethral narrowing, and sometimes a rotated penis or concealment of the penis by scar tissue, and these could also require further surgery. So now I'm going to get into more of the long-term psychological effects, and a lot of this is speculation, so I'm going to approach it from that point of view. So there's been a lot of scientists and psychologists debating whether penis circumcision causes psychological problems long-term. First, we can acknowledge that only 45% of doctors who perform circumcision use some anesthesia. So the newborn is having a piece of their body cut off without any medicine or even barely any. We don't think this is a big deal because a baby doesn't talk. It cries all the time, so how do you know if it really hurts them? But obviously, by the time a baby is born, it has developed nerve endings and a brain developed enough for it to experience pain. In 1997, a Canadian doctor performed a study with different groups, and they obviously had to have one group with no anesthesia to use as a control, and they found that it was just incredibly painful and unethical to continue. And even the group with nerve block had so much pain. One of the babies ended up choking, and one had a seizure. They also found that the pain of circumcision causes the baby's brain to rewire itself, so it's more sensitive to pain later. This is why a lot of studies are being done about how this affects depression, anger, low self-esteem, and intimacy problems with young men. I can't say this is a fact because there hasn't been enough studies to prove it, but it does make sense. Prenatal stress on the mother can actually affect the child in the womb and affect them later in life. So if certain hormones can affect a fetus, wouldn't a direct mutilation on their body as a newborn affect their psychology? This is obviously not for you to decide as a parent or your own feelings about the subject, but you cannot deny that the fact that this is an extremely painful thing for a baby to experience, even with anesthesia, which is rarely given. At least the amount of anesthesia that would justify it or make it comfortable. 1 second. So I'm not sure, I have another part, but I'm not sure if I should just cut this one short and then, because the next one's about sex, so I think I should just make that. Okay, I'm gonna cut this one now, so this one's gonna be like a little baby part, but next is gonna be about the sex portion of it. So I know everyone's getting into the sex part, so watch the next one then.